let's label together the structures on the blank figure of the humerus. The humerus is the bone in your arm. It articulates with the scapula, which forms the shoulder joint, and it articulates with the radius and the ulna, which forms the elbow joint. The humerus is a long bone in shape. Starting with the first figure, this right here is the head of the humerus. The head always faces medially. So that is the medial aspect. This is the lateral aspect. And this right here is the anterior aspect. On the anterior aspect, you can see these two projections right here. And you can also see these two depressions right here. This is the head of the humerus, whereas this is the anatomical neck. Moving to the first projection, this is the greater tubercle. This is the lesser tubercle, which is the smaller projection. This right here is the intertubercular sulcus. Inter means between, tubercular, between the two tubercles, sulcus. And this right here is the deltoid tuberosity. This is the coronoid fossa, which is the medial fossa. That's the coronoid fossa medially. And laterally, we have the radial fossa. Remember, in your forearm, the radius is the lateral bone. That's why when you flex the elbow, the radial fossa receives the head of the radius, which is the lateral bone in the forearm. Moving to the trochlea right here, this is the trochlea. And next to it, laterally, we have the capitulum. So the capitulum is opposite to the head. This right here, on the lateral aspect, we have the lateral supracondylar ridge. Medially, we have the medial epicondyle. So this tip is the epicondyle. Since it is facing toward the head of the humerus, which is always faces medially, that is the medial epicondyle. Moving to the posterior aspect of the humerus, notice how we can see only one fossa and we can see only part of the projection on the posterior aspect. This right here is the medial aspect where the head faces, and this right here is the lateral aspect. This is the head of the humerus, which always faces medially meaning toward the midline of the body so that it can articulate to form the shoulder joint. This is the anatomical neck, whereas this is the surgical neck. This is the radial groove right here for the radial nerve. We can also see the deltoid tuberosity for the attachment of the deltoid muscle. Both are on the diaphysis of the humerus. This is the olecranon fossa. So we have one fossa posteriorly. It starts with an O, olecranon fossa. It looks like an O and it is on the posterior aspect of the bone. This is part of the trochlea. This is the supracondylar ridge. Which one? That's the medial. Notice that the head faces medially. So that's the medial supracondylar ridge. This is the medial epicondyle. And this is the lateral epicondyle. So both are epicondyles. However, one is medial and the other one is the lateral. I hope you found the video helpful. Check out my next video on the anatomy of the radius and the ulna.